The following is an Investor Brand Network audio production via our audio press release solutions. As a multifaceted financial news and publishing company, Investor Brand Network utilizes its network of more than 5,000 distribution partners as well as other corporate communication tools to introduce public and private companies to a wide audience of investors, consumers, journalists, and the general public. Investor Brand Network's platform connects the investment community with companies that have great potential and a strong dedication to building shareholder value. The following audio press release may feature a client partner of Investor Brand Network. Investor Brand Network may have been compensated for the production of this audio production. Please be sure to read our entire disclaimer for full disclosure.
Network Newswire presents Breaking the Habit. Psychedelic stigma fades as research points to critical use in smoking cessation and more. There isn't a cigarette smoker in the world who doesn't know smoking is bad for them. The problems are that nicotine is one of the most highly addictive substances in the world, and for the nearly 70% of 34.1 million Americans who want to kick the habit, there aren't many smoking cessation options that have proven safe and effective. Hope may be looming on the horizon, however, with new research building on prior studies that suggest psilocybin is not only a potential solution, but also a more effective one. Leading a charge on this front is Mydecine, Innovations Group ticker symbol MYCOF, a biopharmaceutical firm formed in 2020 for the purpose of developing innovative therapeutics to treat PTSD, depression, anxiety, addiction, and other mental health disorders. Mydecine is part of a renaissance for psychedelic medicine research that is showing real promise in addressing areas of unmet medical need. Those contributing to the resurgence includes peers such as Compass Pathways plc, CMPS, Atai Life Sciences NV, ATAI, Cybin Inc., CYBN, and Field Trip Health Limited, FTRP. Cigarette smoking is responsible for 1 of every 5 deaths in the US annually, while sapping more than $1.4 billion from the global economy. Mydecine is emerging as a leader in psychedelics for smoking cessation, partnering with Johns Hopkins University on several drug development projects. MYCOF will be supplying its MYCO-001, pure psilocybin, to an NIH-funded clinical trial led by Johns Hopkins. Mydecine intends to commence 2 separate clinical trials of MYCO-001 for smoking cessation and post-traumatic stress disorder in veterans. Chantix recall leaves $1 billion up for grabs. According to the Centers for Disease Control and Prevention, cigarette smoking is responsible for 1 of every 5 deaths in the United States annually. While the World Health Organization estimates tobacco use costs at more than $1.4 trillion in health expenditures and lost productivity each year. It's not that people don't want to quit smoking. Many do. CDC data shows that 55% of smokers have tried to quit, but only about 7.5% succeed. The desperation for anti-smoking products is exemplified by the drug Varenicline, brand name Chantix, which became a blockbuster with 2019 sales of $1.1 billion, despite serious psychiatric side effects. Ultimately, Chantix was recalled in 2021, not for the psychiatric adverse events, but for theoretical potential increased cancer risk. Perhaps new treatments involving psilocybin, the active psychedelic ingredient in magic mushrooms, will fill that $1 billion void. A small study by Johns Hopkins University, published in Journal of Psychopharmacology, compared smokers trying to quit using cognitive behavioral therapy, CBT, plus varying doses of psilocybin to abstinence rates typically observed in smokers using other medications or CBT alone. The results showed 67% of the participants remain nicotine-free at a 12-month follow-up, a substantial increase over success rates for other methods, typically 10% to 35%. The study concluded that the results suggest that in the context of a structured treatment program, psilocybin holds considerable promise in promoting long-term smoking abstinence. Johns Hopkins is conducting a larger efficacy study with compelling data to date, and this month received the first National Institute of Health (NIH) grant in more than 50 years to directly investigate the therapeutic effect of psilocybin for tobacco addiction. Mydecine Innovations Group, ticker symbol MYCOF, is an integral part of this landmark NIH-funded research led by Johns Hopkins, a 3-year multi-site smoking cessation study being conducted in collaboration with University of Alabama at Birmingham and New York University. Mydecine will be supplying its lead drug candidate, MYCO-001, 99% pure psilocybin, for use in the clinical trials. The supply agreement, in the words of Mydecine CEO Josh Barch, quote, not only offers a significant opportunity to further advance our drug development through safer and more viable results, but demonstrates Mydecine's leadership position in the emerging psychedelic-assisted psychotherapy industry, end quote. The joint work on the new clinical trial builds upon the budding relationship between Mydecine and Johns Hopkins, considered the top university for psychedelic research globally. Denver-based Mydecine was already working with the team of Dr. Matthew Johnson, a psychedelics authority and professor of psychiatry and behavioral sciences at Johns Hopkins, on smoking cessation products using psychedelics. In August, that partnership parlayed into a 5-year master collaboration research agreement to look at several novel therapies and compounds for the treatment of a multitude of mental health and addiction disorders. Johnson is the lead on the upcoming NIH-funded trials and will be lending his expertise to other upcoming clinical studies by Mydecine. Catalyst clinical trials for MCO-001. Clinical trials are milestones and catalysts for biopharma companies, and Mydecine is staring at 3 of them in 2022 for MCO-001. First is the NIH-funded multi-center study. Second is a company-sponsored seamless phase 2 to 3 clinical trial, also evaluating the administration of MYCO-001 with a structured smoking cessation treatment program in nicotine-dependent individuals. The trials will run concurrently, and Johnson will be serving as principal investigator in both trials. Encouraged by FDA Commissioner Dr. Scott Gottlieb in 2017 to speed up drug development, a seamless clinical trial utilizes an adaptive design to combine 2 or more traditional phases of the FDA process, which can save not only considerable time but also significant money. Mydecine anticipates its investigational new drug meeting with the FDA this quarter and to commence another study in January 2022. The study protocol is expected to involve treating participants weekly in one-on-one sessions for 5 weeks prior to quitting smoking. Primary endpoints will be smoking abstinence at 3, 6, and 12 months. ResearchandMarkets.com estimates the global smoking cessation market to be growing 16.9% annually to reach $63.99 billion by 2026. The rapidly expanding market and room for new products to capture significant share likely underscore Roth Capital analyst Elamer Piros initiating coverage on Mydecine with a buy rating and $3 Canadian price target. PTSD in veterans, EMS and frontline workers. The master collaboration agreement with Johns Hopkins demonstrates Mydecine's commitment to advancing psychedelic medicine by exploring multiple molecules and medicines for a variety of indications. One of the first targets is post-traumatic stress disorder, PTSD, in veterans, emergency medical service, EMS, and frontline workers. Currently, there are no medications that have been developed to treat PTSD, and those that are prescribed to treat the symptoms can be addictive and often have unpleasant side effects. Mydecine is expecting an IND meeting with the FDA this quarter and plans to start a Phase 2A study involving veterans with PTSD during January 2022, spanning 3 US sites, 2 Canadian sites, and 1 in the Netherlands. A holistic approach, MYCO-003 and MindLeap. While those trials progress, Mydecine has 3 other flagship drug candidates in the pipeline, including MYCO-003, a psilocybin formulation that combines a serotonin agonist with a serotonin-releasing agent. Fact is, a bad trip is a possibility when ingesting psilocybin, which requires supportive care from the attending physician. The risk can be exacerbated by patients with high anxiety or PTSD, which Mydecine believes it can mitigate without the need for extensive supportive care through its novel formulation. The company has recently reported positive preclinical data on MYCO-003 and filed a patent application as an anxiety-reducing product. Many people receiving psychedelic therapy refer to the experience as spiritual, religious, mystical, and the like, which gets to the breakthrough opportunity of the treatment by addressing the root cause in the brain rather than putting a band-aid on the surface. Healing and meaningful change are processes that are part and parcel to psychedelic regimens. Mind Leap Health, a unit of Mydecine, supports this journey as an inner wellness application and community that provides tools for self-discovery. MindLeap offers a comprehensive platform that introduces users to psychedelic integration, dream analysis, and deepening awareness with top experts as a part of a holistic, real healing approach.
This audio press release is an original broadcast provided by Investor Brand Network, a multifaceted financial news and publishing company that delivers a new generation of corporate communication solutions, including news aggregation and syndication, social communication, and brand awareness tools. Investor Brand Network may receive payments for the services and solutions provided to its client partners. You should assume that the owners, officers, and directors of Investor Brand Network or financial analysts mentioned in this audio production may hold a position in and may intend to trade the securities on their own accounts. This audio production is not an offer or recommendation to buy or sell any securities mentioned in this audio production. The information in this broadcast is presented solely for informative purposes and is not intended to be or should it be construed as investment advice. As in all investments, investment in the featured companies carries an investment risk. Listeners should review the companies thoroughly with a registered investment advisor or registered stockbroker. This audio production by Investor Brand Network is not purported to be a complete study of the featured company or other companies mentioned. Information used and statements of fact have been obtained from featured companies and other sources but not verified nor guaranteed by Investor Brand Network as to completeness or accuracy. Such information is subject to change without notice. Please see our full disclaimers and disclosures at investorbrandnetwork.com.